Where is the leak? In this edition, we're going to talk about some not so obvious locations of CSF rhinorrhea. Uh, CSF is a fluid that surrounds the brain, and sometimes when there's a breach or a defect between the bone that divides the brain from the sinuses, you can have a leak of this watery CSF drainage coming from the nose. This leakage typically is not subtle. It's pretty obvious when it occurs. It has a salty, characteristic taste. It is very runny like water. It is not mucousy. It is not thick. And when you bend over, it seems to worsen as well. If there's any question about whether this really truly represents CSF rhinorrhea, I would recommend using Atrovent nasal spray and giving that to the patient to see if it helps their runny nose. If it helps their runny nose, this is not CSF. CSF rhinorrhea can also be confirmed by sampling a very small sample of it and looking for a protein called beta-2 transferrin, which is really only found in the CSF. And so it's a pretty definitive test for CSF rhinorrhea. Typically, the leak is only occurring on one side, and so the patient can usually describe to you that it's either the left or the right side where the leak is occurring. Sometimes a CSF leak location is pretty obvious on a CT scan or MRI. In this image here on the left, this CT scan shows that the right sphenoid sinus is filled with fluid, and there's a little bit of a breach of the lateral aspect. On the MRI to the right, there is some herniation of brain contents into the right sphenoid sinus, which makes it really obvious that the right sphenoid is the location for this CSF leak. Here's another scan on a patient that was complaining of right-sided nasal drainage. And if you look really carefully in this region right here, there's a little bit of density herniating below the cribriform plate, right there between sort of the posterior supreme turbinate and the septum. Pretty subtle in that location there. Here's another patient with right-sided nasal drainage. A little bit more obvious potentially that this is a culprit. There's a little defect there on the anterior aspect of the skull base. But if I look further back posteriorly, I see maybe another defect right in that region there and some opacification posteriorly in the ethmoids, which makes me wonder whether there's two leaks or just one leak. Typically, there's really only one leak. I guess lightning could strike two places at the same time, but typically not likely. And here's an intraoperative view of what it looks like in the nose of that last patient. The middle turbinate has been resected from this area here, and so as we go in there, you can see CSF welling up. Now, this CSF is slightly tinted yellowish in coloration or fluorescent yellow in coloration. We did use intrathecal fluorescein to help color the CSF. This is paced by through a lumbar tap by our neurosurgery colleagues at the beginning of the case. And I've suctioned away that drainage, but you can slowly see that drainage come oozing back in that area here. So this is right along that anterior aspect of the lateral lamella of the cribriform plate as the site of the leakage in this patient there. And there you can see it kind of welling back up. Slight yellow tint here from that fluorescein dye. This is an interesting case. This patient came in with left-sided intermittent rhinorrhea that would occur with strenuous exercise or bending over, but it wasn't profuse and draining all the time. And you can see here, oh, there's a subtle little blip along the skull base near the cribriform plate, actually near the lamina propria out there laterally. And perhaps here on that sagittal view, you can see a little blip of soft tissue herniating down from the skull base and into the anterior ethmoids on that side. And here's what we found intraoperatively. There was a small, unusually round defect in the skull base there with a little bit of granulation tissue herniating down. Apologize for this little bleb of blood along the inferior aspect of our view, but there it is. There's that little hole that we saw on the CT scan, and you can see the brain and meninges really herniating down with a little bit of granulation tissue in there. And so a repair of CSF leaks can be done in multiple fashions, but small leaks like this can be repaired with soft tissue. whether you use alloderm or temporalis fascia or fat. I often put a plug of tissue or a layer of tissue intracranially and then a layer of tissue extracranially, and then utilize some sort of soft tissue glue to help seal that area postoperatively, and then pack beneath it with gel foam as well as an absorbable packing underneath. So that's our video for today. Hope you found that interesting. Let me know if you have any questions or what experiences you might have had with CSF leaks in the comments below.